I thought that initially I'll just talk about normal sleep. What's your definition of a normal sleep? How long should you sleep? There is only one answer. No, the right answer is enough. How can you judge if you've had enough sleep? Correct. You wake refreshed, thinking straight, and thinking positively. And if you try to get back to sleep, you can't. If you can get back to sleep, then you hadn't slept long enough or well enough. If you sleep longer in the weekend than you do in the week, you're getting inadequate quantity of sleep or inadequate quality of sleep in the week. Now you guys are all a bit older than 30, as polio has dying out, as I'm afraid so are you, and me, and us all. So small children sleep 2/3 of the night, unless they're rat bags. And we'll talk about the rat bags a bit later. As you get older, you get less sleep. You need less sleep. But more important than that is that the structure of your sleep changes. Sleep is made up of several different sleep stages. There's very light sleep, stage 1. There's a deeper sleep, stage 2. Then there's very deep sleep or slow wave sleep, which is stage 3. And then we dream. And that cycle repeats itself through the course of the night. Slow wave sleep is the sleep that your teenagers have. You know, you can vacuum the room, rake up their clothes, because they never pick them up, and they won't wake. As you get older, you have less and less slow wave sleep. So by the time you're 70, you've got very little. Now, the depth of sleep was governed by the noise intensity that it took to wake you. So stage 1 sleep, a small noise can wake you. Stage 2 sleep, it requires a bigger bang. And as I said, in stage 3, it needs a bomb. So now, as you're getting older and you need less sleep, but you're more fatigued, more physically tired, and therefore think you should sleep longer, those are tensions that move against one another. You're now being disturbed by your snoring, belching, kicking, farting partner. Now, I have no advice to offer about that, except to say that it's quite okay, often, to isolate the bed. 2 mattresses on one bed base, or 2 beds pushed together, or 2 beds pushed apart, or 2 rooms far apart. But I do always warn my patients that once you've slept apart for a while, you don't get back together. That can lead to interesting things in the bathroom, out in the yard, hopefully in the dark and in the privacy of a high fence. And you then go back into your own rooms and sleep. Circadian basis. We wake up in the morning. We should be exposed to bright light, which suppresses our body melatonin and starts our 24.5-hour clock. We have a clock in our brain which is crap. It's meant to be 24 hours, but for 80% of people it's 24 hours and a bit. So if we're living in a mine or a nuclear submarine or somewhere with controlled light, we get slowly and progressively out of sync. And it's the exposure to light in the morning which restarts the stop clock. Bright light exposure in the morning is critically important. Now, not only does wake and sleep go with this 24 and a bit clock, but there are body hormones that cycle in the same way. Cortisol is highest at 9 o'clock, lowest at 3 in the morning. That's part of our fear, fight, flight, I want to go to work and have a fight type hormones. So everything in our body is governed by this ticking clock. Sleep architecture, I've just spoken a little bit about that and I won't do that again, except to say that in REM sleep or dreaming sleep, the body's paralysed. The reason that it's paralysed is that you can't afford to act out your dream with your bed partner, as exciting as that may be. It's a very, very active brain time. So when we're paralysed, our muscles don't work. And I don't need to tell this audience that. The trouble is the body's stupid. It can't distinguish the muscles in the legs which it wants to paralyse from the muscles in the throat which it's relying on to hold the throat open. And that's why snoring is always worse about 60 to 90 minutes after sleep onset. And obstructive apnea is worse at that time. Not only that, the brain loses its chemical control of breathing. So normally if we have a slight rise in carbon dioxide, that normally would stimulate you to breathe harder and faster. And it's the most exquisitely controlled control mechanism in the body. A 1 millimetre of mercury rise from its normal 40 will stimulate an increase in breathing rate and an increased depth of breathing. But during REM sleep, that chemical responsiveness is lost. And we're relying on our rat brain to give you a periodic breath. And that's probably why none of us in this room have more than 20 to 25 minutes of REM sleep, because we would be placing ourselves at greater and greater risk the longer we were in REM. Now, when your muscles start to go and you start to get breathing problems during the night, it's seen first in REM sleep. And that's why we do sleep studies to deal with these sorts of issues. There are different parts of the brain and they're all connected together and they all talk to the suprachiasmatic nucleus, which is a particular part of the brain which is quite small. And that's next to the reticular activating system in the brain, which is the part of the brain that wakes you up. And those two bits talk to each other all the time. But there's an input from the retina along the optic nerve, which also goes to the suprachiasmatic nucleus. There's outputs from the suprachiasmatic nucleus that go to the motor nerve cells and to the motor cortex. All of these things talk together. The body is amazingly clever. Does anybody know what these are? Well, these are Drosophila, or the fruit fly. And the fruit fly can be bred to do anything. There are fruit fly which have been bred to have a 1 hour day. So they sleep and are active, sleep and active. There are Drosophila that have been bred to have 24-hour clocks. There are others that have been bred to have 26-hour clocks. And there are some that live and breathe 18-hour clocks. So that's allowed us to tease out which gene, and it's called PER1, is the body clock gene. So a lot of the basic science has been done with very simple animals. You know about the circadian clock. We are most useless between 3 and 4 in the morning. Those of you who are reaching that age, what happens between 3 and 4 in the morning? Well, that's where your surgeon will do his best for your surgical emergency. Hopefully he'll be awake and moderately alert. It's also where the people controlling the dams to generate electricity are working. It's where the engineers checked Columbia before it took off. So it's not a good time. There is another sleepy period in the day which is just after lunch, 12 to 1 o'clock.
Postprandial poop.
Yes. Now the Latin peoples make use of this. They eat late, go to bed at midnight, which is the most optimal time for sleep. Then they wake up at 6 or 7 as normal, work, knock off at lunchtime, sleep for an hour and a half, go back to work again, don't finish work till 6 or 7, but they're using their body clock. What a lot of people don't realise is that there are 2 periods in the day where you can't get to sleep. And that's between 5 and 7 p.m. and between 10 and 11 a.m. So these are sleep-averse periods. And sending somebody to go to bed earlier, if it doesn't fit in with their body clock, will not work. So we have to live with these circadian clocks. Melatonin, very important hormone, produced in the pineal gland, which lives at the top between each hemisphere, and it talks to everything. Melatonin is released about 2 hours before bedtime, rises to a peak. It's the natural sleep hormone, and it is suppressed in the morning by light exposure. And that suppression occurs through the retina, through the optic nerves, and there's a little branch through the nucleus of Edinger-Westphal which goes to the pineal gland and switches it off. Your problem, ladies and gentlemen, is that you're, in our definition, old. You all have a deficiency of melatonin. And as we get older, melatonin levels fall. And that's another reason why when you wake from your farting, belching, snoring partner, you then can't get back to sleep again because of low levels of melatonin. Correcting melatonin would be the logical thing to do. Trouble is, melatonin's got a very short half-life. And in the pineal gland, it's released in a pulsatile fashion, repeatedly. So when you take a tablet of melatonin, you have to take 1,000 times the physiologic dose just to make it last long enough. And in volunteer rats, it causes your testicles to shrivel up when you're using those sorts of doses. So buying it off the over the counter from a health food store, it's not food. This is a physiologic hormone, and you're better to use low doses 2 hours before bedtime, 1 hour before bedtime, at bedtime, and if you wake in the night. Little doses. This is just highlighting that you can get progressively out of phase unless you have light exposure. And these experiments were done in caves in Europe with red lights, because red light doesn't have this melatonin suppressing capacity. Roughly 60% of people are longer than 24-hour sleepers. About 5 to 10% are shorter than 24-hour sleepers, and the rest are around 24 hours. And there are a lot of other rhythms, all of which are connected together through these genes per 1 and per 2, which is a stopwatch. So, why do we think sleep's important? I've set up here all animals do it. Think of an animal that you think might have difficulty in sleeping. Dolphin? How does a dolphin sleep? Half a brain at a time, that's exactly right. So it has hemispheric sleep. So does the sea otter. What about the Indus dolphin, which swims continuously in the Indus River? How might that sleep? Well, it has repeated micro-sleeps. So for 2/3 of the day, it's as dozy as hell, because it's asleep and awake, asleep and awake, asleep and awake. 1/3 of the day, it's fully awake, and that's when it herds fish together as a pack. They talk to each other, and they hunt together, because they're fully alert. What other animal? Elephant? Elephant can sleep. It has a special knee which locks back to allow it to sleep upright, with the cantilever of the head and the shape of the back causing a cantilever curve. If it lies down, it doesn't breathe properly, and it can only lie down asleep for about 20 minutes. Flatworm. Does a flatworm sleep? Well, of course it does. It has wriggling time and still time, which sleep specialists say is unquestionably sleep. If you trap deer and you put them in a paddock, you have to have a very low stocking rate. And that's because deer are alerting animals. If they're disturbed, they whistle and disturb all the people within range of the whistle. As the deer get habituated to the paddock, you can increase the stocking rate. But it's still not stacked as high as a dairy herd. The stocking rate of a dairy herd is much greater. They're bigger animals, they eat more. Why on earth can you carry more of them in the paddock? Well, the reason is that if you don't allow deer to sleep, they get immune suppressed, their thymus gland in the throat shrinks, that causes a T cell deficiency, they get viral infection in the herd, and the herd is killed. So that's an immune-mediated state. If you have a volunteer, and as soon as they drop to sleep, you wake them up, in 4 days they'll be raving mad. And in 10 days they'll be dead. We cannot survive without sleep. If you sleep 6 hours a night as a normal variant, you die quicker than if you sleep 8 hours a night. Rather worryingly, if you routinely sleep 10 hours, you die younger than if you routinely sleep 8 hours. Now, we don't know why that is, but there's a U-shaped survival curve around 8 hours of natural sleep. Short is bad, long is bad.
What about shift working?
Shift working's always bad. Once a shift worker in the sleep field, always a shift worker. Fragmented sleep, easily disturbed, shorter work hours, and I hate to tell you, fatter. Short sleepers have appetite hormone variations which lead them to eat more. So abnormal sleep, this is a structure that I use to think around what sleep disorders are. So disorders of the initiation, can't get to sleep, and maintenance, I can't get back to sleep, are the insomnias. Now sometimes there are phase advance syndrome. Phase advance syndrome is when you go to bed at 10 o'clock because your partner says you should, and you sit awake and you finally get to bed at 1 o'clock. And if you were allowed, you would wake up at 11 o'clock and feel fine. This is the teenager. Late to bed, late to rise. Now if the rest of the world did that, they'd be fine, thank you very much. Unfortunately, they have to get up to go to schoolie, and we have to get up to go to work. So we're chopping off the last 3 hours of their circadian sleep. Would be a bit like me waking all of us here at 3 in the morning and saying, time for work. That's phase delay. Phase advance is when you get home tired as anything, want to go to bed, struggle to stay awake because of social demands. You need to have a conversation with this partner that you haven't seen for a week because they've got the opposite sleep disorder. And you finally get to bed at 10, feeling knackered, but you're awake at 3, ready to go. So that's a phase advance of the body clock. Phase delay is the teenager, late to bed, late to rise. And you can think of these as larks or owls. And all of us have a degree of owl in my case, or lark in my wife's case, which is why I haven't seen her for a fortnight. The disorders of excessive sleepiness. These are the people who nod off in meetings, and I've been watching very carefully. It's never normal to nod off in a meeting. It's never normal to nod off in front of the TV. Common doesn't mean normal. And I use myself as an example. You might look at me now and think that I'm pleasantly plump. Thank you. In 1950, you might have looked at me and thought, shit, he's morbidly obese. I haven't changed in those two scenarios. It's just that the background has changed. So you look around all your mates and they're just as dozy. Therefore, the concept of normality changes. Our expectations change. And as sleepiness creeps up on you, we don't realise we're sleepy. We just change. We don't like to go out in the evenings anymore. We don't drive in the afternoon. We'll choose to sleep over and drive in the morning. I'm driving 2 hours to Hamilton. I'm going to wait to have somebody in the car with me so that I can talk to them. We don't realise we're doing this because we're sleepy. Second problem is we're very good at finding an excuse. I've got polio. I'm a professional person. I'm a shift worker. I'm allowed to feel tired. Stop picking on me, woman. Third problem is all your mates are also sleepy. So excessive sleepiness often only comes to attention when you've had a car crash, or when your boss finds you asleep in a meeting, or your headmaster in the teacher's briefing in the morning has to wake you to give you your day's assignment. So an incident has to draw it to your attention. The most common cause of excessive daytime sleepiness is we just don't sleep long enough. We sleep on average an hour less now than we did in 1950 because we've got lights. Television. We didn't have television in 1950. So there's all these extraneous things that conspire against us. Obstructive sleep apnea. This is the snoring that occurs and then ends with a pause. And what you see is this. Now the silence was the person trying to die. And they're about 1.5 minutes from dying. The gasping arousal is your brain saving your life at the cost of waking you. And that can happen 500 times a night. My sleepiest patient had crashed his car 12 times in the 10 years before I saw him. 8 years before I saw him, he'd killed a pedestrian on a pedestrian crossing. 2 years before I saw him, he'd drifted across the midline on the way to Hamilton and killed an English tourist family in a camper van. His insurance company knew not to insure his car, but nobody had told him he had a health issue which was completely fixable. So that's one extreme. The other extreme is the person who just now has to read a board paper 4 times and makes notes in the corner. Whereas before they used to read a board paper once, make a decision and move on. Worse than that, they used to be able to make the decision, move on, and now they fret about it. They've lost their confidence about decision making. So the changes can be quite subtle. Restless leg syndrome, periodic leg movements, these are the repetitive minor twitches of the legs. Many of you will have this, or the crawly, unpleasant, hard to describe sensation in the legs where if you're trapped in an aircraft seat you want to shoot yourself. One of the diagnostic tests for restless leg syndrome is to be bound down on a gurney to see how long it takes before you go mad. I'm exaggerating slightly. Narcolepsy is a genetic condition where the waking up hormones in the brain are deficient. That's approximately 0.05% of the population have narcolepsy. The majority are still undiagnosed, but these are the people who have sleep attacks. So they're feeling okay and then they're asleep and fall off the chair. Or their face ends up in the soup. Or they'll have cataplexy, which is where they start to dream while they're awake. And consequently, their muscles will go weak. And that can be triggered by laughter or by anger. So these people try very hard not to laugh. They become very socially isolated because they don't want to be stimulated into laughter. These are the people who in the workplace will insist on a single office, because if they're in a communal office, somebody will laugh and they'll fall off the chair. It's an extraordinarily debilitating condition. Abnormal behaviours during sleep, the bumps in the night. These are the sleepwalking, sleep-talking family of disorders. 10% of you in this room did it as children, maybe as much as 30%. But most people grow out of it by the time they're 6 or 7. And we all think of that as a joke. Sleepwalking? What a hoot. Unless you're a gorgeous 28-year-old manager of a youth hostel in Fort Street, where there used to be a youth hostel, who'd wake up in the morning and she's in different clothes. Or she'd be in jeans that are wet from the knee down. And she has no idea where she's been, what she's done. Or she's grabbed on the stair by a good, kind Swiss student when she's naked. Wraps her in a blanket, takes her back to the bedroom, and she has no recall in the morning. So this is not an entirely benign condition. REM Behavior Disorder, this is a disorder of older men. You'll recall that I said when we dream, our muscles are paralyzed. And if those inhibitory pathways are degenerating, then you can start to act out your dreams. Now, fortunately, most of the dreams that we have are of falling, being tangled up in nets, running from people, rather than getting a chainsaw and killing somebody. So these tend to be random thrashing movements or sudden leaping out of the bed movements. But the patient can injure themselves, or a partner of a patient of mine had her jaw broken by her partner who just randomly threw his arm out. This responds exquisitely to medication once you recognize the diagnosis. And then there are some of the epilepsies which range from bizarre to completely bizarre and unbelievable. So this is what I teach GPs. It's very simple in every consultation to say, how do you feel you sleep at night? Are you sleepy or tired in the daytime? It's preferable to always ask the partner, because men never tell the truth. They don't know the truth. And who's going to tell them anyway? And asking about snoring on most nights is an important question. Never normal to not offer meetings. If you're snoring, that means your airway on which you're relying to breathe is partly blocked. If you completely obstruct, it means you're about to die. This is for GPs. If you don't ask the question, the patient won't volunteer the information because they don't know. We all know we don't snore. And if somebody proves that we snore, who gives the monkeys? And if you start to talk to me about health risks in 10 years' time, who cares? Who's going to live to 60 anyway? This 30-year-old person will say. And I can't emphasize enough, the changes here are slow. Now, all of you will have had that in your post-polio life where you know things aren't right, but you can't convince your doctors that things aren't right because they've seen you too often. And you'll have a child come back from overseas who'll say, God, Mum, what the hell's going on? You look terrible. Because they haven't seen you for 5 years. So this is the insidiousness of slow disorders. Now, I was going to talk quite a bit about insomnia, but I think we'll move on to flick through those. There are some risk factors for insomnia. This is the sleep disorder where there is no other cause. It stops you getting off to sleep or stops you getting back to sleep in the night or makes you wake repeatedly in the night. And in our age group, the first thing that you interrogate about that is what drugs are you on? And that includes the bourbon and glass of Pinot. There's a whole list of these causes of insomnia, and this is what we would go through in the midst of a consultation. Sitting there counting sheep, the worst possible thing for you to do is to say, I hope I get good sleep tonight as you're walking into the bedroom. I'm going to get to sleep tonight. I will sleep, really. And your cortisol levels are going up, your growth hormone levels are going up, your teeth are grinding away, and why won't you sleep? So this is what we call sleep anticipatory anxiety. Now you might think it's all about you, but take it from me, your partner. God, I hope she sleeps before I have to snore. So they get it too. So you get two stressed people going to bed, being civil to one another, but wanting to strangle one another. I can't emphasize bright light enough. Bright light is good. If you're admitted to intensive care, even though you're unconscious, if you're on the light side of ICU, you will stay in ICU 1 day less than if you're on the dark side of ICU. There are architects now who are light design architects, who design buildings with light in mind.
Can I ask about daylight saving?
Yes?
How does, I think it affects me, that doesn't really affect me.
If you stuck to your circadian sleep pattern, it wouldn't affect you at all. If you went to bed when you were tired and woke up when you wanted to wake up, it would be fine, thank you very much. If you try to fit in with a clock change of 1 hour, you've got jet lag for a week or thereabouts. And that's a nice mental way to approach it. Most of us can cope with a 1 hour time shift with little difficulty, but some people can't. You've heard of seasonal affective disorder. This is what happens in the UK. You get up in the dark, you stay in bed to the last possible moment, you scoff some coffee, get into the car or the tube, get to work as quickly as possible. Unless you've got a corner office, you sit in the dark. What you're sitting in now is 300 to 400 lux at head height. What you need to suppress melatonin and restart your clock is 3,000 lux of white light. Now you get that with dawn light, even on a cloudy day. But the moment you go indoors, you half the number of lux that you're exposed to. I won't talk about hormones, won't talk about that, but I didn't know how to switch this fancy doodad off that my son did as an aid. Unquestionable consequences of insomnia or poor sleep. Now, many of the things that I'm flicking past here apply to sleep disorders in general rather than just specifically insomnia. Sleep hygiene, I'll talk a little bit about that. How many of you have had 2-year-old children? Most of you. Now, you remember 2-year-old children. When you were training them for potty training, or before 2, and then you had to train them for sleep. And you turned them into a Pavlovian dog. You might not have realized that you had a dog for a child, but you did. You'd have tea time, bath time, watch TV,
Read a
story in bed or on the couch, jump into bed, and you'd give them a kiss on the left cheek. Now, if you did anything out of order, the little buggers would be out of bed and constantly at you. Even if you kissed them on the wrong side of the cheek. Now, I hate to tell you, but you're all dogs too. So you should have a bed-going routine so that dinner happens, A glass of wine happens, although only one glass of wine. Do as I say, not do as I do. Then you clean your teeth. Then you go to bed. Then you turn over to the left. Then you turn the light out and you go to sleep. And if you don't do any of those in the same order, you won't sleep well. If you get up in the night and you can't get back to sleep, you should get out of bed until you're tired again. Then you should clean your teeth, get back into bed, because this is followed by this, is followed by this, is followed by sleep. We are all Pavlovian dogs under the skin. How many of you here have got a television in your bedroom? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Stupid people. The bedroom is for two purposes only. Reading is fine so long as it isn't a Linda LaPlante book. It should be the sort of book that you don't mind not finishing a chapter, which is a good mental definition of a relaxing book, because you do need to switch off the day in order to start the night. And I have a standard joke in our house was crappy westerns or things like Alistair MacLean, light, fluffy, no intellectually challenging stuff. Because I can read Le Carre from 10 p.m. till 6 in the morning and be late for work, because I won't put it down until I'm done. So there are books and there are books. Textbooks might put you off to sleep, darling, but the reason that I'm here is because they didn't turn me off. Caffeine remains in your system for 5 hours. Alcohol helps you get off to sleep quicker, snore louder, and then have a poorer quality sleep. And these are the people who get off to sleep well, bugger up their partner's sleep up till midnight, then they wake up around 2 in the morning and they sleep fitfully. This is an alcohol withdrawal effect. How many of you have got up or talked to others who said, I didn't sleep a wink last night? It's quite common. And I've had patients in the sleep lab who get up in the morning and you say, see, doctor? And the undercurrent is, you bastard. I didn't sleep a wink. And I take them into the sleep lab and I show that they've slept 76% of the night. But they have had frequent wakings. Now, if you wake for 1 minute at 1 in the morning, and 1 minute at 1:30 in the morning, and 1 minute at 2 in the morning, you think you've been awake for 1 hour. And we call this sleep state misperception. And you can't convince people that that's a likely diagnosis, because they are so entrenched in their position that until you show them, and it's the only time that I'll do a sleep study in insomnia, is to show them that in fact that they did sleep. And once they realize that they are sleeping, the tension goes out. So the first thing we do with those sorts of people is that we shoot the clock. Remove it from the bedroom. And if they're anxious about waking up time, that can cause a sleep anticipatory anxiety that they might not get up in time. and you reassure them that you put the clock outside the door, or you put the clock in the bedroom and put a plain brown paper wrapper over it. Just some way of removing it from vision. If things have changed, if your sleep has been good and something suddenly changes, then something suddenly has gone wrong and you need to work it out. And I'm afraid for the men of us in this environment, that's often your prostate and the need to get up for a pee. For women, it's often the partner disturbing them with the onset of sleep apnea. Work stress, school stress, financial worries. I had a very bad period of stress because I built my new $2 million sleep facility just before the financial crash, and the money arrived, the 2.2 million arrived in my bank account from my bank manager about 1 month after the onset of the financial crash. And he was a very big man, bigger than me, 6'4" and 190 kilos. He has sleep apnea, which I told him when he went to sleep in a meeting with me. He also didn't seem terribly stressed by the fact that he had loaned me a lot of money, which he should have been. So the worst thing that you can do is to spend, if you're feeling tired and fatigued, is to spend too much time in bed. Because if you're an 8-hour sleeper and you go to bed for 10 hours, 25% of your sleep time is going to be spent awake, which is going to cause you to feel anxious. So you may have heard of the term sleep restriction or limitation of time in bed, so that you're trying to increase the percentage of the time in the bed during which you will sleep. And that's part of the therapy. You can't make those changes quickly, because if you suddenly go from 12 hours in bed and I tell you go to bed for 8 hours, you'll be moderately anxious. But if I say every week shorten it by a half an hour, then it's a manageable thing, because you make adjustments slowly. Yeah.
Why in our rest homes do we put our seniors to bed so early when they require a least amount of sleep?
So the question is, why do old folks in rest homes go to bed so early? And the answer is because if you have less staffing at socially unacceptable hours, it's cheaper. It makes no sense. We also don't light our rest homes appropriately. There are not enough courtyards. We should be allowed to sit outdoors. The idea would be to breakfast at 7:30 al fresco, except in Auckland where it's always pissing down with rain. Exercise is good. There's a lot of work. If you want a reference, Anconi, Israel, has done a lot of the work on melatonin in seniors in rest homes and how to manipulate light and improve sleep quality. But it happens in all of our homes too. It's just that it's not so blatant.
Exercise. Can I ask you, doesn't that rev your system up and increase your metabolic rate, and if it's too close to bedtime, it then keeps you awake?
Yes, so the best time for exercise is in the morning after you've had your breakfast al fresco. You go for a walk. Take the dog for a walk. Exercising last thing at night is wrong, because you've stimulated cortisol and you've stimulated the fear, fight, flight hormones necessary to function at a higher level, and it takes 2 to 3 hours for that cortisol and catecholamines, adrenaline, to come back to normal.
Even if you're an owl?
It's all that an owl is increasing the distance between the exercise time and bedtime. So the more owl you are, the better. But remember, it may be the reason that you're an owl. White light isn't white light. It's a mixture of all of the colours of the rainbow. And 3,000 lux of white light is equivalent to about 400 lux of green light or blue light. 3000 lux is very bright. It's screwing up eyes bright. But you can achieve exactly the same effect with 400 lux of green light, because the melatonin suppressing effect of light is wavelength specific. So we've got some fancy glasses which have little green LED lights here, which you can wear in the morning in Auckland where it's raining in order to reset your body clock. Blue-green light suppresses melatonin most. One of the other problems of that is that computers and TV screens produce blue-green light, or blue light in particular. So people who use the computer in the evening are not allowing their melatonin to rise. Watching television doesn't allow melatonin to rise. So we import some blue blocker sunglasses, which are amber coloured, and if you look at something blue, it looks black, to filter out that light. And for those of you who are computer nerds, you can download an app to change blue light dominant screens to warm light or orange-yellow light screens. You can't do that with TVs, I'm afraid. So your teenager who's on Twitter, Facebook, computer screen is adding to their owl-like nature, and they'll be even more useless and grumpy the next day than they would otherwise have been. But these blue blocker sunglasses don't make, it's not like dark glasses. It does change the perspective of what you see, but it's tolerable. The green light glasses are very effective. We used to use white light boxes or green light towers, and the reason that I chose green light rather than blue light is that there was some literature a few years ago suggesting that blue light might cause cataracts and retinal damage, and NASA have chosen the way they will manipulate light for the Mars mission, and I figure that they've been able to spend more money than I have. Now, NASA has done light manipulation for many years, and again, you might not realize this, but if you ever remember looking at astronaut training films or videos, you will be struck by the whiteness of the environment. All the walls are painted white, the roofs are white, and that's because they manipulate the light. So it doesn't matter what clock time the astronauts take off, they're taking off at 9 a.m. body clock time. Now, since the Columbia disaster, the engineers checking the seals are also now rechecking the seals at 9 a.m. engineering body clock time, not at 2 a.m. as they were on the day before that disaster. There's a whole family of these sorts of things. This just emphasizes what the world looks like from space at night time. And it's just a measure of how much artificial light we generate in order for us to live our existence. And it really is a crazy existence. This is a composite night photograph taken from Skylab. What do you think this is? How many people have flown in the last month international? This is a 24-hour picture of planes flying in the world. And you can see during the night all of the transatlantic flights. Europe lights up as soon as the dawn hits. Flights between Australia and New Zealand. All of these pilots with all of these patients, or about to be patients, are well rested, functioning at the top of their game. All these businessmen who are landing functioning at a high level as they play with your 200 million pounds, your investments. They're all making very good decisions in the boardroom. And these are just the top guys. When you think of all of the cleaners and the people who are making things, it's pretty scary how we've completely altered our life by manipulating our environment without consideration of who we are. I'm happy to take any questions on either sleep. We haven't covered any of the breathing related problems, which I'm happy to do if that's of interest.
Teenagers that take a long time to wake.
Yes, there are two ways to deal with that. You can either start schools late or you can light schools better. And I think, to me, it makes much better sense to have schools working in 2 shifts, and you have an early shift and you light it brightly, and you have a later shift to make more efficient use of the facility, and you get the larks in the first session and the owls in the second session. The main issue with polio and sleep is twofold. The first is that I think, but I've no proof, that snoring and obstructive apnea is more common in polio, particularly where neck and shoulder muscles were affected. Breathing is certainly affected during sleep in the majority of polio patients who've had diaphragmatic involvement, and I've ventilated many polios overnight, every night, continuously. For my longest patient, I ventilated for 28 years.
I'm just giving Andrew a list of statistics about polios that we pulled out of our survey.
The other 2 big considerations are restless leg syndrome and just pain. Pain causes you to wake from light levels of sleep, and if you then can't get back to sleep, it's very difficult. So the survey suggests that 1/3 of people are breathless during normal activities, which is not too surprising because you've got the mechanical disadvantage of your peripheral working muscle, and breathing muscles may be affected. Many people with polio are overweight because they are not able to exercise to the same degree to burn what's considered a standard diet. Shortness of breath when talking. Well, shortness of breath when talking is entirely governed by the strength of your inspiratory muscles, because in order to talk, we have to take a breath in. The bigger breath we take in, the longer we can talk. 12% asthma, well, that's probably population prevalence. Hay fever, 20%, that's probably what's common in the community, not polio specific. Difficulty breathing through nose or either nostril, that's usually nasal disorders, and 14% is probably what it is in the community. 24% difficulty swallowing and choking. Now that's a real issue, and that's to do with the 3 pharyngeal swallowing muscles, the constrictor muscles. We make a food bolus by playing with it in the back of our mouth and tongue, and our tongue's designed to roll a food bolus into a bolus. As soon as that bolus touches the last third of the tongue, it relaxes the first pharyngeal constrictor muscle. As soon as the food bolus touches the top of the first pharyngeal constrictor, the bottom of the first and the top of the second will open, so that you have this effect of squeezing the bolus through the 3 muscles till it hits the gullet, when the smooth muscle of the gullet just takes it down to the stomach. So there is a coordination and strength issue with forming the food bolus. And many of you may have had a barium swallow where you have to manipulate a marshmallow and handle a drink of barium. So that's designed to look at the top end. The reason that it's important is that if you get bits of saliva and tooth garbage down into your lung, I will cough it out and you may not be able to. So the rate of lower respiratory infections and pneumonias is much greater in people with swallowing problems. Waking short of breath, it's got a myriad of reasons. It can be cardiac or pulmonary, and sometimes we find it difficult to tease out, but that's a serious thing to think about. 25% wake with a start for no obvious reason. It's normal to have the sleep starts. That's where you're about to drop off to sleep and you get this electric shock-like jump. Now usually that occurs electrically just after sleep onset and we don't notice it. But it can occur in very light sleep when it's like an electric start. Most snore. Well, regrettably, most people snore at this age anyway, but I know I don't snore. 57% often have restless sleep. I think that this is mainly to do with the fact that we all turn over several times at night, and people with polio don't turn over as much, so that you have the effects of pressure as well as the primary effects of neurogenic and musculoskeletal pain. Restless legs and jumping at night, a real issue. I don't have a sense for the true prevalence. It does respond if you've got true restless legs, this uncomfortable, crawly, deep, unusual discomfort in the legs. It's associated with deficiency of iron in a certain part of the brain, which is why it's more common in women than in men. And in women, it's more common while breastfeeding and when menstruating heavily. It tends to improve around the menopause and then worsen again. And people with iron deficiency have more of a problem. And people with renal impairment have more of a problem. So if your iron levels are in the lower third of normal, I replace that first, but then it also responds to drugs called dopaminergic drugs, which are similar to drugs used to treat Parkinson's disease. And it can be very difficult to manage. Wake a lot during the night, well that's for all of the above reasons. Nightmare of drowning, suffocation, this is often associated with obstructive apnea, because if somebody's obstructing you, or if you're obstructing yourself, and that occurs while we are in REM, then we build a story to explain that. And that's frequently being tangled up or drowning or being smothered by somebody. 20% waking with a headache in the morning. If that's a consistent feature and you're sleepy, you're almost certainly not breathing adequately during your sleep, and you might need the support of a breathing machine used at night. 32% waking even more tired in the morning. Again, we should be able to do better than that, and that suggests that you may have sleep apnea or restless leg syndrome, or your quality of sleep is poor for some other reason, but you shouldn't put up with it. There are sleep services in every DHB of varying standards. Regrettably, most of you will not have health insurance because nobody would touch you with a barge pole, or at least historically that's been the case. And most of the DHB sleep services are obstructive sleep apnea services rather than sleep disorders services. But nonetheless, I think that's a useful starting point. And you should ruthlessly get your GP to refer you, because the more referrals that are received, it forces somebody to think about the problem. If you don't ask, nothing will happen.
I was very interested in the question you just raised, because 5 years ago I asked for a referral to a sleep clinic and was told I couldn't have it because of sleep apnea.
A far more effective way would be to drive a petrol tanker and say that you nod off most days while you're driving. Usually that gets attention and you'd be seen within a month. So the question is about power naps. So when we sleep, we go into sleep for 1 to 2 minutes in stage 1 sleep. We then have around 30 minutes of stage 2 sleep, and then we'll go into slow wave sleep, then we'll dream. If you wake from slow wave sleep, you wake feeling ratchet, drugged, almost nauseated. It's a very unpleasant feeling, which we, because we're polite, call sleep inertia. So it's very important to wake before slow wave sleep. Now what will save most of you is that you don't have much slow wave sleep. But if you're going to have slow wave sleep, it will be after the first sleep cycle. So even though you have much less, you're still going to be at risk of sleep inertia. And it's very important to set the alarm for 20 minutes or 30 minutes to wake you before you get to slow wave sleep. And that will be refreshing, and that's been discovered for a long time, and people have made a lot of money out of writing books about power naps. But this is what Maggie Thatcher used to do, it's what Winston Churchill used to do during his manic phases, during his depressed phases. He did a lot of his painting and slept much longer. So power naps are perfectly acceptable. Best time to do it is in that 12 to 1 o'clock in the afternoon period, or if you're driving to Turangi in 2 weeks' time, please have a power nap just before you leave to keep you awake on the same road I'm driving on.
In the beginning of your presentation, you were talking about how as we age, we get less and less down into what you call slow wave. So if a person doesn't recall their dreams, does that mean they're not getting down to the slow?
No. Dream recall is very interesting. I can monitor brain waves, and older people, 100-year-olds, have just as much REM sleep as 20-year-olds. If I wake somebody in the midst of REM sleep, they will be able to recall dream content. If I see the end of a dream period and wait 1 minute, 60% of people will recall dream content. If I wait 2 minutes and wake people, 40% will recall dream content. And it progressively drops off minute by minute down to about 15%, which is the natural dream recall rate. Now, I myself have recalled only 3 dreams ever in my life. All 3 were when I set my alarm a half an hour early or an hour earlier to catch an early flight. And I've been woken in my last REM period. So people who are habitual dream recallers, they'll come to me and say, I feel fantastic. I remember all my dreams and it's fantastic. Whereas I'm sitting there saying, geez, your sleep quality's crap. What is waking you repeatedly in the night? And it's almost always snoring and sleep apnea. For night lights, again, you have to start the way you are prepared to continue forever and ever and ever. And woe betide if you get a flat battery and the lights go out, because they'll be out of bed and into yours in a blink. So night lights are just part of the Pavlovian routine of going to sleep. Not bad, but they come at a cost.
Do you have the app that you talked about, change the blue light to a
Well, I just pull out my stylish blue blocker sunglasses and I haven't worried about it. But there is an app available on the Apple website, and I'm sure there'll be one available for the PC. it's certainly been written about.
When you've had your sleep, and perhaps you might wake up at about 1 o'clock or 2 o'clock, and so at that time of the night quite often you get sort of dark thoughts maybe that sort of take over your mind. And on the radio and listening to talkback and hearing everybody else's problems and taking out your problems.
If you're that way inclined, I would lock the rifle away before you go to bed and make sure the pills are in a high cupboard. And I suspect that you'd get just a much better quality of sleep if you tuned into talkback radio and shifted about 5 kilohertz either side to get that background hiss. Most of us get wound up with talkback radio.